Good morning, everybody. My name's Maria, and I'm the chair of the board. What a wonderful, heartwarming story, and what a courageous story. Angela wanted to come here today, but she wasn't able to. But Ruth's informed me that we have sent some flowers to her home as a thank you for sharing her story. And her story is overwhelmingly one of care and those little things. I remember a few years ago going to the Unison conference, and one of the ladies there, who's a nurse in Landock, she got an award, and the reason she got an award was every Wednesday she would go in on a day off and wash older women's hair on the ward, and it made such a difference to them. And it's amazing to hear. Well, we all know the difference it makes just getting your hair washed. A couple of years ago, I was here at your last conference, and there was another very moving patient story. Mrs. Reynolds, I don't know if you remember, she'd entrusted the care of her boy to us. She was from the Valleys, and she was really overwhelmed coming to Cardiff, this massive big city. And her boy had learning difficulties. He was an adult, and he was cared on many wards in our health board. And each and every ward, each and every nurse really cared for him in the way that Angela was cared for, with compassion and with love. And she trusted us, and when the big snows came and she couldn't get down from the valleys, she said she was okay because we knew we'd look after her boy, and we did. And after the last conference, after that patient story, I stood up on the stage and said to you that that is the real story of the NHS. That is the real story of your care, the care that you give day and night, every single minute. It's not the story that is out in the media, and it's not the story that is generally spoken about in politics, which tends to be statistics and numbers. That's about real care, and that's the care that we're proud of in Cardiff and the Vale. Last time Adam and I were on this stage, and a question came from the audience, and you asked whether the negative media at that time would get worse. And I said it would, because we had a general election coming up, and health would be a political football. And I think, if you remember, it did get worse. And I'm not going to dignify repeating any of the things that were said or naming any of the people. I'll just say that some of them were patently untrue, unfair and wrong. But I personally grew very concerned about the impact of the unfair negative reporting and the political debate on yourselves, on your morale, and also on the public. So we tried to do a number of things to publicise the work you do, as I said, day in and day out, to try and redress the balance. So it was great to see the monthly heroes in the Echo, and I'm looking forward to celebrating with those monthly heroes. Saying that, there's more than one hero every month here, and we all know that. We've given as much publicity as we've been able to for some really amazing things. Our cardiac unit, the Children's Hospital, and you saw yesterday that interactive radiology suite, the first in Europe for our children. And there were some really brave children there yesterday who forgot for a while and enjoyed themselves. And we invited, as you all know, the BBC in, and they filmed for 24 hours in our A&E, no holds barred. And we all saw the interviewers change before our eyes when they witnessed firsthand your work. They witnessed the challenges that you face, and they listened to your patients and the families that you support. But I also was concerned at the same time about the public. We were getting letters, and there was an article in the Echo, a letter in the Echo, about some particularly older people reading this stuff, listening to this stuff on the radio and the TV, and feeling frightened to seek care. So what I started to do is attend public meetings, and I have been doing that for the last 2 years regularly across Cardiff and the Vale. It's been amazing, it's been different. So it'll range from the Bangladeshis women's group in Grangetown to the Wick Pensioners Club in the Vale, the youth clubs, the over 50s, the National Pensioners Convention, voluntary groups. And the reasons I do this really are to listen to our public and to share the truth about your challenges, your performance, our performance, things that they're not going to read about elsewhere or hear, and also an opportunity to resolve any issues that they may have at that time. I never know what to expect, I never know how big the audience will be, and there's been some wonderful occasions. I ended up staying on and doing a yoga session, and everyone was in all dressed in black, and it was superb. I bought my raffle ticket for a tin of tomato soup as the main prize. But what it has done, it's built up relationships. At first, the audiences were a bit distant and distrustful. But now, 2 years down the line, going back, they've started, and they share their stories, they share their ideas, and they want to help. They passionately care about the NHS, and they are so grateful for the care that you have given them and their loved ones. No matter what is said in political arenas, in newspapers, on the radio or TV, the personal experience of people in Cardiff and the Vale who you serve is overwhelmingly positive. You know, just a very small example, only 2 weeks ago I had a meeting in Cowbridge Road East, and one member of the public made a special effort to come because she wanted to stand up to talk about the care her mum had on a ward in UHB. I'd seen her a year before, and she was one of the most cynical members of that audience. So people are actually coming out of their way to tell their stories. As you all know, we've got a winter ahead, and we have an Assembly election ahead in May, when health will be the focus and the football. Although I have to say, we're getting very good with the football in Wales at the moment, so it's not necessarily a bad thing. And you know the challenges, we're all familiar with the challenges. And it's likely, again, that the next 6 months will be the focus of political attention. But I just want us to remember that it's because of your commitment, your innovation, your ambition, your resilience and professionalism, and your care, those little things that make a difference, that this health board, Cardiff and the Vale, is bringing down waiting lists faster than anywhere else in Wales, has the lowest crude mortality rate in Wales, has the least number of patients waiting over 12 hours in A&E in Wales, has a 98.7% survival rate in our cardiac unit, in the top 3 in the UK and in Ireland, has excellent stroke care, opened the Children's Hospital before schedule so we could take care of children elsewhere in South Wales who needed us, has dedicated, integrated health and social care teams, mental health teams, district nurses in the community, and provides excellent health care to the most vulnerable in our society, the asylum seekers, those seeking refugee status, people who are in prisons. And I could go on. But my message really is simple. Over the next 6 months, it's going to get noisy because it's an election year. However, the care you give speaks louder than anything else. Anything else. So, on behalf of the board, I would like to say a massive thank you. You know, Angela's story, as Mrs. Reynolds' story did, reminds us, and it's what happens every single day. And it's your care that makes such a difference. And I'd like us to end with a very brief clip reflecting on what you've all achieved over the last year and reiterate what Ruth said. Let's take a day to stop, to enjoy, to reflect, and to be proud of yourselves. So thank you.